Good evening, everybody. This is Dr. Rao coming to you live on all the usual channels today. Welcome. Um, this is the day 14. Hi, Julie and Wisdom. Thanks for joining me. And I'd like to continue the exercise and the importance of calming the mind. Um, I had a good discussion yesterday with Sanya coming in and asking some good questions. So, even though the exercise I'm really asking everybody to take a trial is very simple, but the subject is pretty vast. It is like a big deal, right? Calming the mind and then using the thought according to what we did. So a lot of people uh, live with the chatter, or they may resort to medications, or they may resort to alcohol, things like that. I'm not saying medications are entirely bad, but it's better to preserve our natural capabilities of being silent by ourselves. So it's like a misunderstood faculty, the thought. It has its use, but if it is not really well controlled, it can lead you to real problems down the line. Right? That's what I was talking about. Okay. So anyway, good evening to all of you, whoever is joining me on Clubhouse and LinkedIn, Facebook, and YouTube, and other channels, Twitter, and also the Wisdom too. Uh, Please come up and engage me in some kind of fascinating discussion with your own contributions and with your own ideas and experiences. And let's learn from that too. But basically, what I am saying is we are letting our minds be influenced by so much of information, so many stimuli, and that is really causing problems down the line for a lot of people. Okay. The immediate problems are that if you go on thinking, your focus will be affected. Okay, say a lot of people don't have good focus because they want to uh, everything in seconds, right? The TED talks and even big deals, they want to talk within 18 minutes. Everything is like kind of you are losing the time for what? I don't understand. What are you losing the time for? What are you going to use your time later on? So if you cannot have joyfulness and focus and really relaxed enjoyment of anything, I don't see the value of saving the time like that. Anyway, uh, the real dangers in the immediate aftermath of this information overload is attention deficit, poor focus, and poor memory, and also some of the casualties of the relationships. People are not listening to each other. People are not paying attention to somebody, what they are saying, what they mean, and all that, right? And a lot of energy waste too. These are immediate side effects of allowing the mind to go whichever thought it wants to go all over the place. Versus if you are able to keep the thought in the right perspective and use it when you need to use it in a focused flow way, you will save a lot of energy by not having this unnecessary extraneous thoughts to whatever you're doing, but like really getting the quality of the work done. You see, that is the benefit immediately. In the long run, you will be sleeping all the time and you'll be relaxing, you'll be regenerating your mind, so your faculties will improve too. There are certain uh, special faculties that you could inculcate if you do certain types of what they call mantras or poems in ancient wisdom, that they repeat them several times a day, where they don't allow the mind a chance to escape from whatever they are uttering, right? And that's the secret of saying the one particular, not necessarily mantra, but even a one word that you take and you repeat it several times, and you don't give the chance to the mind to escape somewhere, then you are better off. Okay, and your mind will be focused. Your mind will be doing something with quality, right? So several implications are in this, but basic commonsensical thing I'm talking about is the culture has changed and the flow of information has really tripled or quadrupled. What do you say? So much information, right? In any profession, even if you are not having a profession, you will have to use the enormous amount of thought. Okay, that is the reality. And if you allow that reality to dominate you, you are running the risk of really having some lower, higher intellectual functions. We said memory, imagination, and tenacity, flow, all those important, and then awareness, all these things will suffer. What I am saying is develop a practice whereby you take a break. That's all. It's as simple as that. Okay? Take a break. The break should be complete break though. Not like I'm going to take a break from the Facebook on this iPad and go to my iPhone to go to the clubhouse. That's not it. You got to take a complete break from everything, and then align your breathing and align your awareness together. Thereby you are really resting the mind and giving it a break. That kind of thing is very much needed in this time. That's my point of view, because this is coming from a physician and also informatician. From a physician, because I'm concerned about what kind of suffering people can avoid, or they can go through the suffering when you expose themselves to unusual amount of material, like I'm seeing with the kids, with the youth, with the employees, or my colleagues, all of them, or there is a to something like a take a alcohol drink or smoking or drugs and all that, which is obviously very harmful to you. I'm not making a moral judgment here. I'm just stating a fact that I see. So be smart, be aware, and be in the moment and calm your mind habitually. Twice a day is good. I recommend go to the same place, same time every day, or get just after getting up and just before you go to sleep, you do this deep breathing exercise that I'm going to show you later in the program. I'm sure a lot of people have already done that, because I have been showing this all these 14 days. This is the 14th day. I plan to do for 40 days together. So all you have to do is sit properly, have a posture where the spine is erect, and close your mouth and take deep breaths through the nose. 7 count inhalation, abdominal comes up, and you hold it for 4 count, and then you breathe out for 4 count, for 8 count. Okay, and the abdominal goes to the spine. That's all. That's the exercise. But during the exercise, you keep your sensation of air touching the nose, and also you watch your thoughts. Don't indulge or don't suppress them. And then at the end of it, you realize that you are not just this limited body and mind, but you are the awareness behind. That is when you are in the present moment, here and now. You live now. Okay, that kind of practice washes away most of the accumulated whatever happened during the day, and puts you into a nice uh, clean slate of the mind. That's the goal. Okay, if you sleep on something like that and then get up in the morning, and again in the morning, don't let your thoughts come right away, but be in awareness and go there for a few minutes and spend there, and then go on to your regular things. And later on come back to the presence once in a while. 1 minute every hour is recommended. If you cannot do every hour, at least few times a day, so that you are anchored in your present moment mind, not really running to the front or turning to the back. Okay, that kind of thing. So think about this. You don't have to do it just because I'm saying. Think about it and make sure that you have examined this to the full extent. If you have any questions, reach out to me and I'll be more than happy to engage with you and then see your special situation where you can go. You can DM me or you can just send an email to my email address or put in a note in the website too. Okay, or you can join our wellness club too if you wish. This is a wellness club I run in the morning and in the evening every day. Actually, it's very good for me. All I'm doing is when I'm doing this, I'm allowing my friends to come and join me too, if they wish to, and then they do an hour of uh, experience in the awareness and then being in the movement and deep breathing in while they're doing asanas, while they're doing breathing exercises and also meditation. All those things happen very casually and to the limit that they want. But what happens at the end of the day is you will be established in the present moment. You will be deep breathing. That's why your system is relaxed and resilient to deal with the day. Whatever that comes, you don't react that quickly, but you will respond. Okay. And also, you needed your body, so your body is really stretched, and then because of the stretch, you demand more blood supply to those organs, and then because you're deep breathing, your oxygen saturation will be better, and you get all the oxygenated blood to the whatever organ you are demanding to work, right? And all the at the end of it, you will be alert and energized and insightful and touch the primary uh, sound. That's the Om I talk about. And also, you are touching the mm, undifferentiated consciousness. That is the aim of the yoga. So much more involved in that. I'm just being brief here. But if you have any questions or anything, you can always direct message me or come and join our wellness club and tell me how you feel. You can do a trial too before you really enroll yourself into that. Okay. But you see, my story is I'm a physician, I'm an informatician, and also yoga practitioner, and a very keen student of ancient wisdom. You know, more than my MD degree, more than my master's in biomedical informatics, I value the ancient wisdom because they have opened my eyes to so many universal truths, right? And they were the ones who went into deeper exploration of all the existential issues. And then they have even neuroscience, even consciousness people, everybody is looking to that now. So I am very privileged to be able to read and then understand and put some of the principles into my mind. But still, I'm a student. That's what I'm saying. Okay, so they are really fascinating human beings, the ancient rishis and yogi persons and all that, right? So even one insight, if you really go and explore yourself, that can change a lot of things. So you have to do it yourself. Okay. For me, I will tell you one insight that really changed me. I was right after the um, medicine I completed in India. I came here, so I was about 27 years age, probably. And then I was exposed to J. Krishnamurti, who talked on the video and the audio and all. Right? I was watching a video, and then he talked about silencing the mind. He talked about ending of the thought. For the life of me, I couldn't understand what he was talking about, ending of the thought, because we were taught thought is good, deeper thought is good, you have to think a lot. He said, yeah, that's all fine for the external things. For the inner being, it's not the thought, it is your intuition. So you got to really calm the mind so that you can see who you really are. You know, that kind of thing. So, hi, Sonia. Okay. How are you? Good. Okay. Just a little sore throat. Okay. So I was talking about an experience I had with Jay Krishnamurthy's talk back in '80s when I first came to the country. Say, he was talking about ending of thought, you know, and then having the silence and all that. So that perplexed me because at the time I was under the impression thoughts are good, deep thinking is good, we are all supposed to think very well and all that, right? Um, but so I could not separate what is good, what is not in thought and all that, where it is going to be good, where it's not, you know. Then he clarified it very clearly. See, outward going, anything that you want to do in the life, you want to find a way, you want to go from this place to that place, you need a map. All those things you need the thought and language, learning the skills of the, lot of things. That's very good. But when it is going on continuously in your mind, that's what he was talking about. You have to end that kind of thought so that you are really with the what is going on. You are not putting a like a concept, like a conclusion, like something else to see something what's going on in front of you. So he said, what is sacred. So if you can see what is without your colored um, experientials or concepts, or without your imagination, oh, this could be that and all that, but you have to see it. That means a bird is in front of you. The moment you see the parrot, you really don't see the parrot, the bird itself, but the name and that's association characters, all those that were taught to you or you learned in the past, they come to you. So that means you are actually missing the bird and you are seeing your own conclusion of the bird as how it should be. That kind of thing. So the moment I understood, I got out of that train of thought, bringing in into my experience, everything changed. Everything changed. Do you understand, Sanya, what I was talking about? No, can you repeat that? Yeah, that's why I said, because it was difficult for me just to understand, leave alone bringing it into my experience, right? Then I used that. He said, a kid, if you show him a bird and tell him this bird is this name or whatever, you show him a parrot and he says it's a parrot, he will never be able to see the bird because the parrots could be different colors, right? And then parrots could be different breeds and all that. But then he will have only one fixed idea of the parrot how it should be, and if it should be green, only then it's a parrot. Then he will miss all the parrots that are of different colors, right? So that is there for him too. So it's a kind of he missed that. So it's a question of uh, being in the moment and looking at whatever that is present to you instead of putting your thought first and looking through the thought. Make sense now? Yeah, I see. Yeah. You given a different example once. I like that. Yeah. You say, for example, Sanya. I know Sanya Sandara, and I have some opinion about her, right? And then I'm looking at Sanya through that image, for example, right? But then Sanya comes today, she is completely different mindset, different mode. Okay, so she may be want to be more pleasant, more whatever from yesterday, whatever, right? But if I have seen something like some negative, something like that, then I will never catch you who are in a very good mood. This happens in the relationship, right? People look at their images, especially wife and husband or long-time friends and all that. Initially they'll be very very nice to each other, and then they're okay, but then they form an image about this friend, and suddenly the friend goes through certain transformation, and they can't deal with that because they want them this way, that I thought she should be like this. You see what I mean? So suppose you come, and every time you come, I see you fresh, completely fresh eyes, and then daily interact with you, what you are at the time. Then you feel like you are validated, you are recognized, you are really accepted as you are. You see, you don't have to pretend to act or behave certain way. You can be yourself. Then I will be relating to that who is present to me. Very, very important, because people marry saying that I love you and all of that. Maybe that is attraction only. But after live a few months or years, then they feel, oh, this person doesn't agree with me. Mindset is different, habits are different. Living together, then I came to know her and all that. So what exactly happening is they have removed their heart, and they put this evaluating mind in front, and then assessing people through the egoic structures. And that's when the separation, divorce, and all this happens. So the implications are enormous when you can deal with people as they are rather than according to your image. You get it?
Yeah. I'm glad you brought those things up because, I was thinking about relationships today, right?
Yeah,
What affects us every day, right? And because
yeah,
we're interacting with other,
yeah.
people
Mm-hmm.
around us.
Mm-hmm.
And so it's so appropriate, of course, in terms of calming your mind and dealing with the situation, whatever, in this case,
Yeah,
whatever relationship we come to encounter, right?
yeah, exactly.
So,
See, that's why my mind don't react right away, because there's a gap, right? And there's so I respond to the task without having that reaction, which is usually emotional or judgmental or something like that. Okay, that kind of recedes. Then what happens is you become more professional, but not being mechanical professional, but really genuinely professional. Like, if you go to the hotel, the person who is there, she laughs, smiles at you because it is her job to smile at you. But if she puts the feeling like a human being and then smiles at you, then you feel much better. You see? So you can train people for that. Okay, well, my nurses, for example, they, when they come, first you have to, if the person is here and you know about him and you're happy to see them, like, at least, so what you do, you look into their eyes and then you smile, or you just greet them, you say their name, and then you tell them the situation, you make them comfortable. If they are not able to walk, obviously they will do it naturally to help them, but make an extra tone in the voice and greeting, all those things matter, you know and that's what I train them. And they say, how is that we are so effective with the patients after you train us? That's because I want the human being in them to greet my patient, not the title of nurse, not the title of MA. I have only nurses and medical assistants, right? Not the title, but the title is on their name badge anyway, because that's the requirement that we want to patients know who they're treating, so that's important for them to know. So, do you understand what I'm talking about? Mechanical smile by somebody misery inside, but then outwardly they smile at the hotel, versus they are really interested in you, they really want to help you, they want to make an extra effort and all that. That makes guests feel very hospitable, right?
yeah. I'm gonna step back a little bit, and you said you're training your nurses, right, to be like that. And
Yeah.
if you look, if we step back, what is it that, like, from you, right? Now I'm looking at yourself that is transferring that kind of, if we say, energy, right, or
Yeah.
even the qualities that you want the nurse to exhibit. To be
Yeah.
able to do that, you have to be able to say something that also trigger something inside them too, right?
Because,
And
yeah, I know what you mean. What it is it is my capacity to nurture. That's what I have to develop, right? Yeah, am I expecting anything from these women in return to that? I'm expecting them to have a good patient experience. Okay. I always told them right in the beginning, this is not about promoting our services, making more money. That's not it. It is about what is the interaction in anywhere here or at home that you could learn that will help your life to be elevated, and then the atmosphere here in the clinic elevated, and also you're not stressed out by the people who come. Some are negative, right? Some are very very rude and all that too. So you understand how to protect yourself too. So there is a lot of nurturance involved in that, you know. So like a father nurtures the children without dominating them, that's how you come across. Then they know. See, there will be times when they are in trouble in their life, right? Some girls have come around 17 years to work with me, so they are very young kids, but they have completed the medical assistant, and they come. They don't have the life experience yet. Something happens with the boyfriend, or some are pregnant or whatever, right? Then they get really terrified because the situation, whatever it is. You know, one girl, she is a nurse, and then but still she was found that she has polycystic ovarian disease, and then she was so upset because she didn't know much. She's got some cancer, like, you know. But then I take them under my wing and then give them special time, and then make them go home if they need to, that kind of thing. When they see those impulses of care, they know, right? You cannot fake it, you know, they know. So the same thing happens with the yoga practice too. There are a lot of things taught to you that you don't know that you are getting them. This calmness, this inner quietude or resilience, all that grows over the time. But the design, the intent, and all of that were there from me, right? And that's why when they accept and do that without them knowing, they know that training gives them that resilience.
Yeah, I love that. I
Yeah,
think it's also not only nurturing but empowering as well.
yeah, yes,
That, not in many ways, right? Not to
yes,
fear, and because in kind of we want in many ways, right, to have everyone be
yeah.
not only
There's
the
another prince.
accountability part, but
Yeah,
also be, loving where they work, right? In many
yeah.
ways.
Yeah, it's actually it's a love, but then it's not like a personal love. It's more not really engrossing love, you know. But the thing is, the word you used, empowerment, Sanya, that's what it is really. Because you see, if you are secure psychologically inside, right, then you can give that security to anybody without getting threatened. Because you don't need to be nurtured. You don't need to be. It's not ego. It was this wisdom that was happy to go and come to for this to get a secure like that. But they do this with the set down and went and say with them, and then by the conclusion all that. Then on that I'm in all of us at what is already so security when you come and you them for the say that is very very them that way. They're almost back into the not way to do, but at least you know, uh, you really do, then you will spend your time. They do find out themselves, and then uh, and they can't come to in the process. What I tell them, the same nurture be given to the patients who are coming, and the side effect the, that they had a relationship with patients that they developed, and that itself was rewarding because just for that girl, because she does the painlessly, or somebody will come, oh, she will get my so they develop the relationship, right? So I will improve and so we are labyrinth of the patient, and then they work, they go and bring her doctors, and then she will go and they'll get the doctor that, but then one or two months she had because what is so I gave them a call. I said no job less or okay is for them, but then I said unless you bring the chart, then it means you are the patient care. Then 983. So things are not for that. All people got motivated because they saw the meaning in their life. Meaning of doing this for them, arranging them, making it available, no delays there and all that. This kind of thing, you have to work under it. But when you work with me, then my responsibility is how to read your mind for what is good for you. You discover it. That.
Yeah, that's beautiful.
Yeah.
And the only thing is not everyone is as lucky to have an employer like you. So what do you then, how do you deal with the situation where employers and employee relationship are not as
oh yeah, it happened. I was in Nigeria and right? So right when residents do one for residents, but I stayed on because they second year I had the license, so we work in if we want to extra money and all. So somebody got me into this nursing home where I went there. That became the employee, and the nursing home became my employer, right? And then there is this horrible administrator who is really rude and really abusing everybody, physicians, nurses, and all of that. I encountered that. When I encountered that, all the people were afraid and then afraid of him and all that. Then me, then I said, I'm here and working here for this. You need to understand. I don't, even if I need it, I won't stay in this job with you being the employer. And then I walked off. So situations are toxic. Some people you cannot change them. Just you have to have the courage to walk them off from there. I don't need the money because I have other incomes coming. But then even if I need the money, probably I would walk off from situations like that. See, that is the internal security gives you. It doesn't look for conveniences. It doesn't look for just to adjust to the situation. All those are bogus. You got to maintain your own inner, dignity and then truthfulness I was silent to him. I just stopped and then walked off, and he was stunned. He was stunned. Him, I believe, So that is there. The other places I went there, actually, I grew on them, Sanya. And then they adopted my management style. They made me the chief president, right? I was the youngest one. Everybody is above 40, 45, but I was the 27, 28, I think, after the second year. They made me chief president because I'm literally boss to all of them, right? But then all of them were very apprehensive, very trepidant in the beginning. But then I created certain social things that they can do. Like we used to call resident conference room. And every Thursday, I had this Ella Lilly representative coming in, bringing in lunch for the people. And I invited all the departments, even though our department is the biggest one, there were so many other departments, surgery, oncology, like that, right? So we invited all of them. So I became very popular with those people because they were not doing anything social like that. And then our residents also, we gave an annual for everybody, and brought things and real good, and then the uh, that made all the difference. That means I cared about this. I wanted them to come. So when they saw that, they were very free to know. This was great for
Right. Yeah. In many ways, what you know in internship.
Yeah.
You have to times, right?
There is a little difference there, though. I was a servant leader. See, I'm not leader like I'm going to tell you, you do it. No, I was like, how can you serve these people so they feel they're not threatened? You see, I'm secure within myself makes you do that. But you are doing all this just to elevate yourself, just to get your ego going somewhere. You will never be, uh, you know, winning the hearts of people. But because I told you, right, the whole thing I told you, the yogis, they are secure within themselves. They don't need any fulfillment outside. Economic is all. See, that is the thing with the American society. Everybody are so full of the ego and they want to satisfy that. So they put a smile and do it. But the real intention is what? Is it to empower you or is to make you so that you will make more money for them? People feel that and then respond to it very well. You see, good leaders really have a good following because they have won their hearts, right? So that is only possible when that leader is secure within himself. And that is what I'm teaching all the time. Don't follow, question and understand things by yourself. But then, if the leader is so insecure that he needs approval or he needs compliments, he needs appreciation, then he's relying on something very, very superficial, right? And that's what people allow themselves to, and that's why they become so addicted to these likes and approval and saying all those things, right? And then when they are not coming, they feel depressed. You see?
Yeah. Yeah, the first time when we started all this whole process, right?
Yeah.
I was kind of, resistant that way too, because, I was thinking a right and wrong thing, and you have to be right and all of these things, and then as times goes by, then you kind of like step back a little bit and see that you don't have to be like that all the time, and what that shows me, right, in terms of conflict. I don't like conflict, and just looking at the situation for the way it is, right? What is my benefit in terms of like, if I argue and say you're wrong, and that kind of thing, and it becomes a little bit of a kind of like a war thing almost, right? An argument.
Yeah, I see that. I see that. Okay, but let me tell you another insight. Okay, then you will know what it is. See, ancients were living by themselves, lots of times alone, and then really they are living outward things, keeping the body and eating whatever. That's all for a spiritual purpose of turning inward and realizing who they are, right? Whereas modern people, what we do is we want to make a living, we want to live well, we want to enjoy things, experience things. Nothing wrong with that, but that is our lifestyle, right? So we don't take the time to turn inward and find out there is something much more than just the body and mind. We need the body, we need the mind, but they should be the tools for your spiritual progress. And that is not religiosity, argumentation, all those things. In conversation, he begins to find truth, and in the seeking of the truth of any matter, then you will explore. Otherwise, bigger economically big, that's why we it becomes a not civilized thing. It's going all the time. I'm the deep finally about it. You are really psychologically happy inside. You have to like the poets, the singers, uh, who are spiritually enlightened, they so free to care how a person is. For example, uh, um, the emperor who conquered the world, and he came to India, and he was downing one king after another. There was one kingdom that he came, and then that king surrendered to him. And then he saw everybody in that kingdom is literate, and there was no violence, and people are pretty peaceful and very wealthy too. They are making beautiful things and all. So he was very impressed with the way the kingdom is run. Then he asked, who is responsible for this? And they told him, oh, there was a prime minister. He is the one constructed all this. He is the architect of this. Then where is he? Oh, he went to the forest because he didn't want to stay in an occupied land. So he went to forest. Then he said, just he's not taking or anything. And when he goes to the point, I'm not coming. I don't have a need to. I don't need to come here. Telling the emperor to come here, he's class. About this psychologically. Then he see when you want the people to be you will like that, and you will let them realize their own potential. Okay, whereas if you think I'm going to suppress the masses and all the who are emotionally, spiritually bankrupt and to feel things is still going on. You see?
I mean, in terms of like coming back to,
yeah,
not only the ego and what is the ego, right? It's in some ways is our insecurities, like you mentioned, right?
Now insecurities are okay, but the ego is what it is it's a false image of yourself. Okay, your real thing is different, but then what you develop an image about yourself and all that, that is has to be understood and only can be transcended. You cannot conquer ego. It will be there some sense of subjective sensation, but real subjective sensation is this underlying conscious being. Once that won't come out unless your veil of that ego is covering it, it won't come out. But once the veil of the ego is gone, then you will see this self-sustaining, self-luminous, forever fulfilled self. That's what I'm talking about is possible with this yoga training and other things too.
Yeah. I think throughout that, I came to realize that, yeah, you're right. It doesn't matter who says what, right?
Yeah.
You make it yourself in such a way that you're fine with everything. So, which is kind of like foreign to a lot of us, including myself, right? Because we always think we have to defend,
Yeah.
And
Yeah, that's the way we are trained, though. That's the way. It's not that it's a crime or anything, but the problem is because of the ego, marriages are falling down, friendships are falling down, and corporate culture is full of egoic people that doesn't allow other people to grow and other people to really. A woman who is contributing a lot only gets 79 cents per dollar even now. You know that? Yeah, women in American corporations, they are paid only 79 cents per dollar.
I hear some of the ratios, still the deficiencies there.
Yeah, because the people who make the decisions about going up on the ladder are most of them are men, so they don't allow other people to come to that position where they can change the policy.
Yeah.
Yeah.
And there's, I've seen it. It's interesting, really, the dynamics of, in terms of the corporations and everything else, right?
Yeah.
And it's not just it's all around. Like we are, like as women, we also need to adapt in many ways the masculine kind of behavior to be able to excel in our workforce at times, right?
Yeah, that's like taking the frills away. And that's how it is described. Women have this nice frock, they have the frills, that's why they look pretty and very nice. That's very feminine, very good. But they have to take it away just to wear the pants so that they look like men. That's a joke, like. So they talk about that in the corporate circles. Let's welcome Ashvi, who is here. So let's see if she wants to say anything. Hi.
Hello, doctor.
Hi. How are you, Ashvi?
Hi. Sorry, you weren't audible to me. Am I audible?
Yeah, you're audible to me. Can you hear me now?
Oh, yeah, I can hear you.
Yeah.
Yeah, definitely you're talking about how to calm your mind, and I was actually doing meditation right now.
Yeah.
So I just got done with that, and I came here. I just wanted to ask you, about a certain issue, if you have time. Actually, my father is having this health issue since a very long time. It's of varicose veins. Oh, okay. And I wanted to know if you can guide me what lifestyle changes can help him to resolve that issue. Because if you know about the disease, you know how painful it is.
Yeah. Well, that's very common in a lot of people because they are stationary and then they have this uh, familial inheritance of certain venous status and all that, right? Usually, what happens is if you are moving around and if you are really exercising, the muscles keep the veins pumping up, and then there won't be issue because there are valves in there that will prevent the back coming down into the legs, right? Sometimes what happens is those valves, they become incompetent. They don't hold that well, and also that can be precipitated by your inactive status where you don't make the muscles work or you don't walk and all that, right? But sometimes the veins that you inherited from your parents are having the inherent problem, and then they show up like that too. So it's a question of combination of inheritance and combination of inactivity and also not really making the muscles strong enough. Okay, So, like my head to toe yoga that I do 5 to 10 minutes, I think Sanya knows about it. The first thing we do is we get up on the toes and then come down and we get up on the heels, right? So that kind of strengthens your calf muscles. Those are the ones that can keep the pumping of the venous blood going up. And then there are certain veins that are completely lost valves competency, like I told you, the valves in between. Then we strip those veins. There's a surgical procedure, which is very simple these days. So you can, what you need to is consult, I don't know whether you have already done, it's called peripheral vascular disease specialist. We have that here in America. I don't know about Indian system that much, because I never practiced there, So that should be available because the stripping is very simple, and after that they also can do some massaging and also some wrapping up with tape, like that can keep the flow up, and also he can really keep the legs elevated and also walk a little bit if he can walk, or improve the muscle strength, like I told you, head to toe yoga.
Right. Yeah, yeah, I think that was helpful because he has gone through surgeries, I guess, twice.
Yeah.
But the thing was that he works a lot, but he's always sitting on the on the desk and he's not moving a lot. So
Yeah,
that is, I think, major issue.
that's a very
And
issue.
as
Yeah.
you said,
Yeah, I
inactive
know.
lifestyle.
If you see what I do with Shri, with people like that who are sitting in the chair, I make them do yoga with in the chair itself.
Okay, okay. Is there an option to do that?
Yeah. How? Yeah. Well, I can show you if you want to bring him on my Zoom, and then I can show you guys, and then you can pick it up and do it.
Okay, that was really helpful, and I will
Yeah.
contact you after this.
Yeah, no
So,
problem.
should I like email you or back channel you?
Uh, I will send you the Zoom link. Now I know you. Do you follow me or? Yeah.
I do follow you.
Yeah, it's fine. Okay, then I will send that to you. Okay, Ashi, and then
Okay.
I will back message you the Zoom link, and
Okay.
then you can join that. And usually we have a wellness club subscription. But 1 or 2 days I just do it. But lots of people are like that these days. They don't want to come all the month. But that's important. But I can show you for a day. That's no problem. Okay.
Okay. Thank you so much
Yeah.
for that.
Yeah, only the thing is our times differ, right? So I will show you
Yeah.
in the morning because my yoga club runs from 6 to 7 in the morning and 6 to 7 in the
Okay.
my time. My time is Central US time. That means you are right now. I'm coming to 8 o'clock. Yours must be 6:30 a.m. for you,
Yeah.
right?
It's 6:17 right now.
Yeah, but that is your AM, right? Mine is I'm still
Okay.
in this one. So you are tomorrow
Where do you
already.
practice currently?
I'm in US in Iowa.
Oh, okay.
Yeah.
Okay.
So no problem. We'll
Okay.
try to deal with him. Make sure that he is seen by me, and he sees me. Then we can see what he can do. We will tailor to him. Okay.
Sure, sure, sure. I'll
Okay.
talk to him about this and I'll
Yeah.
ask him to join the Zoom meeting like whenever you get time. Also, I'll contact you first
Yeah. Well,
through
no
the back
back
channel.
channel
Yeah.
here on Clubhouse. Then I will send you the Zoom link. Okay. Then we'll fix the time,
Sure,
and then we'll do that. Okay.
sure.
Okay.
Okay. Okay.
No problem. Okay.
Do you have an Instagram page?
Yeah, but I have so many pages. I don't really keep up with everything. So one thing at a time I do, right? So
Yeah, definitely. Thank you so much for that.
okay.
You can just message him in the background so that way you can have that communicate going, right?
Yeah.
And then you can just go back your back message there, the back channel.
Yeah.
Sure. And along with that, I'll make sure that he does yoga because he has got a very inactive lifestyle. Like he's always
Yeah.
focusing on the work and he never focuses on the health part. So I think I'm doing that work for him.
See, one of the
Just.
things I really take pride in the sense, not egoistic, but I'm really happy about is I usually tailor exercises to whichever stage the person is. It could be child, it could be very old. It could be a very busy executive or somebody who is a housewife and do not want to do anything. There was one lady, I think she's an Indian too. She was obese, and she was so obese she could not get up out of chair, and so she was not able to walk or anything like that. So I met her in one of these rooms like this, and then I told her, okay, why don't you do the yoga in the chair? I will show you. And then she picked it up. I showed her some things that she to do in the chair. Within 2 weeks, she got up and walked, and then she reported to me a lot of weight loss after that. So it's a question of,
That's great.
yeah, we have to suit what you feel like. Somebody like Sanya, she can go and walk and all of that. We may do more vibrant yoga, but somebody who is just not willing to do that much, but she wants a relaxing yoga before go to sleep, we can teach them to. And also, I evaluate their lifestyle, what they are doing, how they are doing, what their routines, and then there are opportunities in the life itself. Like, for example, as a doctor, if I go to a hospital, I can park my car away from the hospital. I can take stairs. I can walk in the corridors. I can stand most of the time, do my work on the EMR, and then I can do office yoga in the chair. And even if I'm in a meeting, I have chances to do. You know how it is. Suppose meeting is there, everybody is going. I kind of contract my abdominal wall and release it. That is very good for the massaging of the organs. Not after a meal, but when it is empty, you can do that.
Right. I agree with that because even I do that when I have my exams or anything like that. Because
Yeah.
currently I'm a student, so I often sit at my chair and I do like some leg movements.
You know
I
who
do
did this?
stretching.
You did this exercise most, Ashwi? The pregnant women who have delivered and the abdomen is so weak and all that, right? They want a flat abdomen. First, I start them with this, and later on, I will make them do abdominal exercises 3 times. And there is one asana called boat pose. You remember, Sonia, boat pose that we used to do? That boat pose? Nava yoga is there, and if you stand on that, your abdomen will be lower part and upper part will be very tight. Even mine is flat now. Say.
Yeah, it's kind of fun too if you incorporate it in your lifestyle, like Dr. Rao.
Yeah.
Of course, had the pleasure of doing that with his wife too. So it's it's one of those practices, not just for your dad, but also yourself as well, right? This room is about the calming of the mind that is fitting for everyone, right? So I just want to encourage that. So beyond that, it's not because we have elderly parents ourselves, right? And so one of the things that helped me going throughout all of these things is not only managing, like we were talking about initially about relationships, right? So, and, dealing and looking and, kind of when you're able to manage your emotions and not only, or release or however you want to term it, right? Then everything else, the way you look at it with the care that Dr. Rao mentioned earlier in the beginning when he was, of course, training his staff, it's the same kind of thing that also affects the environment around us. And also in terms of back again to the calming of the mind, it's such a beautiful thing to see. So
See,
I would
Sanya,
encourage all of you.
what is important to see is life is one big continuum. So it's not like a separate or anything like that. Like we have the elderly people, our parents are not, or, for example, um, some of the yoga that they teach pregnant women, it starts with antenatal. You know, what it does is it kind of prepares them for the delivery. The delivery time will be much less because you are training those muscles you never trained, and you're also doing the deep breathing, and that deep breathing also helps them to really relax during the initial thing. Okay, and then after the delivery, you don't let them just like that. You allow the abdominal wall to really tighten. That way, the spine pain and all those things will be gone. Because the pregnancy, because of the physiological changes that normally happens because the baby growing and all that, right? So once you do this,
Right.
then coming back to that is very very easy, you know. So it's like a life is a continuum. All stages, I kind of look at it as a part of the life, not like a separate and then do that. So young kids, old people, in between, everybody needs this kind of care. But but the body is only our instrument. Mind is also our instrument. We are really
Right.
spiritual, and that's why I focus on.
Right. And I really like the positive approach that you have, because I've been listening to your replays and I have been listening to you since a very long time. And I
Mm.
really like the positive approach that you have towards everything and towards life specifically.
Yeah, Sanya, the other day she sent me somebody said toxic positivity. Right, Sanya? We were talking about the other day because uh, there is nothing like toxic positivity, but then maybe we are doing too much at certain times. That's there, but the toxic negativity definitely is there. What is important is not that negativity affect us to pull us down. Even if you are not
Right.
positive, the negativity is not there, then you are better off. But if you are positive, I don't think we should complain about that. you know,
Right.
yeah,
Thank you so much for that. I'll be taking the leave because now I have to do my yoga and
yeah,
my exercise. So I'll just go.
yeah, sure.
And thank you so much for that.
Yeah, we are
Thank you so
also
much
do
for the
1 hour
information.
here, Ashwi. So Sanya is there, so we were talking about several things. But usually 1 hour. The exercises we will do that before you go, so that we can demonstrate. All I am saying is take a place consistently if you can, or go to a place where there are no diversions or distractions for you in terms of music or TV programs or anything like that. And then just sit by yourself and sit, being the spine straight and both your feet firmly and on the ground. And now close your eyes and take deep breaths with me. And first 5 breaths will be just taking deep in, holding it, and breathing out. But as you take the deep breath, let the abdominal wall come out and hold it. And as you go deep in, breathe out, the abdominal wall goes in. Let's do five for the first time. Okay.
Sure. Thank you for the information. Thank you so much, Sonia. Thank you so much, Dr. Rao. Okay, I'll take a leave now. Okay. Bye.
Second part of it is where you are aware of the sensation of the air makes as it comes out, comes in. Okay, just do the same thing. This time your mind is tied to the sensation on the tip of the nose. The final, the third part of this is very simple. As you are breathing in, ask the question, who am I? As you go in and hold the breath, you know that is the life force that you are. And as you breathe out, you just have not just this body and mind. Doesn't mean you are not that. They are not the only thing. They are limited, and you want to use them as instrument for your spiritual growth. That's why you realize that you are that spirit behind, the awareness behind. Okay, let's do that. 5 breaths. With that, open your eyes slowly and do this every day in the morning, first thing when you get up, and also just before you go to sleep, and in between, just a few minutes if you can. Okay. So, anything else, Sanya?
No, that's been really
Yeah.
great. That's always talked about.
Okay. All right. I'll see you tomorrow again, right? So,
All right.
okay.
Bye.
Bye bye. Somebody is here, busy, or they're gone. Okay. All right.